Hi, my name is John from Body Mechanics Physio. Welcome to week 3 of the running clinic. Hope you've enjoyed week 1 and 2 where we've looked to assess and to give some simple treatments that you can use at home for the foot and ankle and the knee. Today we're going to look to focus on the hip. What we're going to be thinking about with that hip is making sure that we have got full movement, flexibility and strength to control a good running gait. Hopefully you've been getting out there, enjoying this great weather and running well. First thing to talk about with the hip joint before we move on to some of those assessment modalities is to think about the structure of the hip joint. The hip joint is made up of a ball and socket. That fairly large ball fits into a large socket. It has the ability to move in all directions and all motions. Depending on the muscular tightness around that hip can depend on the flexibility you have, but also the axis and slight changes in axis of rotation. What we want to look to do today is assess those hips, check for the flexibility, check you have the correct movement in each direction to then allow you to run and move well through the running gait and hopefully optimise performance and reduce injury. So what we're going to look to do, as we have done in previous weeks, is begin the assessment looking in the mirror. The first thing we want to be aware of is weight distribution. Do I have even weight distribution between the right and left legs? What we then want to think about, as we have done in previous weeks as well, is looking at the alignment. Does my pelvis feel nice and square? Is my pelvis pointing in a straight direction, in the direction of travel for running? We also then want to be aware of the position of our legs. We've previously looked at the position and alignment of the knee, the position and alignment of the foot. If you haven't optimised these already, return to those videos and go through the assessment tools that we've provided. With focus on the hip, what we want to be thinking about is the alignment of those feet, ankles and legs in a good running motion. So the first test I want you to look at is, can we turn the foot outwards? Can I turn the foot inwards? Do I have the flexibility to allow that to happen? And can I do that evenly on both legs? Or do I feel like I have some restriction to either turning outwards or turning inwards? Do I have a restriction within that hip joint to rotation? What we then want to then think about, the second test we're going to look at is, do I have the forward flexion and the extension of the leg to allow me to run well and in a good motion? So what we're going to look to do, popping hands onto hips, do I have the flexibility of my hip bringing up to approximately 90 degrees to come squarely through that motion, and can my pelvis stay fairly neutral as I'm doing that? Can I then compare that to the other hip? Do I feel like I'm hitching excessively on one side to get that hip through into that nice running motion? What we're also then going to do is exactly the same thing but into extension. Nice assessment of the hips and pelvis, and can I extend that leg into extension nicely through a good range without excessive movements of my pelvis or my lower back. And we can do that on both sides, and we're looking to then make that assessment to make sure we have the flexibility through rotations but also forward motion and backwards motions of the legs to make sure that we can optimise our movements through running. The next assessment tool we're going to have a little look at is assessing the strength and control you have around the hip, and particularly the activation of those glute muscles. What we want to do is get some understanding of how you're able to drive through those hips in the push-off to propel you into the forward direction to optimise the running and optimise the speed and control. So what I'm going to get you then to do is just have a lay down onto your back, nice and easily. What we're then going to look to do in the laying position, we're going to look to do very simply, making sure pelvis is nice and square, we're going to look to do a nice two-legged bridge. Just going to think about just rolling up there nicely, a little bit of a posterior pelvic rotation and a rolling up and down. Assessing how that's feeling. What we're then going to look to do is going to come to the top of the motion. What we then want to try to do is keep the body in a fairly nice straight line, and what we want to do is get some understanding of whether I can straighten one leg to a nice neutral position, and can I do the same with the other side. Do I feel like there's a difference between the right and the left hand side in maintaining the control and the neutral position of the pelvis? That will then give us some understanding of the strength and control around the right hip and the strength and control around the left hip. Right, so hopefully we've got some understanding of how the hips move, how they move through rotations on both sides, how they move through flexion, and how they move into extension. We've also started to have a little look at how they control and the strength that we have. So what we're going to look to do now is going to look to run through some simple stretches you can think about doing to further assess the tightness you have within the hips, but then start to implement as treatment modalities to make sure you regain full flexibility and equal flexibility through both hips. The first stretch we're going to have a little look at is coming down into a lunge position, kneeling lunge position. The leg to be stretched is the one behind, the other leg in front. What we're then going to look to do is, in this position, tilt pelvis nicely, so you're tucking your bottom in, you're lunging forward slightly, and you're feeling that nice opening through the front of the right thigh. What we can then do is open arms up above the head and lunge forward slightly with that to be getting a nice stretch through the front of the thigh up into your hip flexors to make sure we've got that nice extension that you're going to use through running. We can then look to transfer onto the other leg in exactly the same way, nice and easy, leg out front, tilt pelvis slightly, so you're tucking bottom in, that's lovely, getting a nice stretch through the front of the thigh, small little lunge forward, getting that increase of extension, and then we can bring arms up above your head into that nice stretch position. So nice and easy, nice stretch for the hip flexors. What we're then going to look to do is going to have a little look at the tightness that's through the back of the leg and through the hamstrings to help us then to encourage better flexion motion and a better stride. So what we're going to look to do is going to come nicely into a hamstring stretch. The lovely thing is we can move from this stretch and flow straight into a nice hamstring stretch, and we're going to look nice and easy with the leg out straight in front, doing a little bit of a sit back. Can I get that leg nice and straight, and can I come down to the ground, and how is the flexibility into the back of that hamstring and up into the back of the hip and the pelvis. Nice and easy with these stretches, trying to keep that back as flat as we can and getting that nice opening through the back of the hamstring. Absolutely perfect. The next thing we're going to have a little look at, so we've looked at motion to stretch in a forward position and increase extension. What we're now going to have a little look at is a stretch to optimise rotation. We're going to look to then bring the ankle across the opposite knee. What we're then going to look to do again, tilting pelvis to stick your bottom out, winding the muscle up into the back of the hip, and you'll feel this nicely stretching into the back with this motion into the back of this right hip. Nice and easy, sitting down into that, hold something nice and support, nice and controlled. Always working on these as symptoms allow, never pushing into any pain, but feeling that nice stretch in the back of the hip. With these stretches, always looking to hold for a good 30 seconds, getting some nice opening, nice freedom of movement. And we can do exactly the same thing, transferring onto the other side, nice stretch into the back of the hip, making sure that we're, rather than rounding the back, we're sticking the bottom out and really feeling a nice stretch into the back of the hip. That's absolutely perfect. So you've got 3 simple stretches of the hip there, one to optimise, as I said, extension, one to assist with flexion, and also then one to improve the rotation and the position of both hips, always looking to make sure that the right and left hand side are equal. So those assessment tools have allowed us to look at the flexibility and also the strength in the hip. Do I have the flexibility through flexion, the forward motion of the hip? The same on the right and the left. Do I have the same extension on the right and left hand side? And you can assess that with the movements in front of the mirror, but also use the stretches as well to give you some understanding of the levels of flexibility you have with those. What we've also then is looked at the control and the strength that we have with the bridging task. With those bridging tasks, you can look to use that as the assessment, but also the strengthening task. If you're finding weakness in one side compared to the other, we can use those bridging tasks and some further progressive bridging tasks to begin to strengthen the side that you found was the weakest. With the stretches that you're doing to maintain flexibility and making sure that the right and left hand side are even, think about holding those stretches for a good 30 seconds, always as symptoms allow and as you feel comfortable to do so. And that goes exactly the same for the bridging tasks. What we also then want to be thinking about is how then that starts to then flow into our running style and into our pattern. What that's going to allow us to do is to make sure that we've got the optimal flexion through the hip, the optimal extension, but also we've got nice degrees of rotation to allow the best running pattern of your hip, which is then going to fit nicely in with those feet and ankles. And what it's also going to look to reduce is unwanted compression into that hip and to make sure that the axis of rotation is optimal. This is going to reduce your chances of injury as well as helping you to maximise your performance. We also need to say that this does not substitute physiotherapy or gait analysis, but what it can help for you to do is give you a little bit more understanding of how your body moves through running and how you can look to optimise it independently at home to take things forward and hopefully assist you with reaching your goals. Hope you found that useful today. We will look to take this on further to week 4 next week, where we will look at understanding how the back should move and the flexibility that we want through that back. Again, looking to make sure that you are maintaining injury-free and maximising your performance.